Dear students, let us learn about the iliotibial tract. So, it's a tract between the ilium of the hip bone and tibia. And what type of tract it is? It is a fibrous band. The iliotibial tract is also known as Mysiat's band, and it can be defined as a condensation of deep fascia of thigh, which is known as fascia lata on the lateral aspect of the thigh. So it's nothing but deep fascia on the lateral aspect of thigh, and it consists of longitudinally arranged fibers, which is a reinforcement of fascia lata. So it is a reinforcement of fascia lata. What is the extent of iliotibial tract? It extends from the iliac crest and crosses the knee and is attached to the tubercle or a facet on the anterior surface of lateral condyle of tibia, which is known as Gerdy's tubercle. In this picture, you are seeing the tibia, upper end of tibia, the lateral condyle and the Gerdy's tubercle, where the iliotibial tract is attached. And in this picture, you can see the iliac crest and the attachment of the iliotibial tract above to the tubercle of iliac crest, and then below, after running along the lateral aspect of thigh, it gets inserted below onto the Gerdy's tubercle, and at the junction of upper 1/3 with the lower 2/3 of the thigh, the iliotibial tract splits into two layers, a superficial and a deep layer that encloses the tensor fascia lata muscle. That means the tensor fascia lata is inserted into the iliotibial tract, and that part of iliotibial tract superficial to it, that is the superficial layer, is attached to the anterior 5 centimeters of outer lip of iliac crest, whereas the deep layer that is passing deep to the tensor fascia lata blends with the fibrous capsule of hip joint. The muscles attached to the iliotibial tract or the tensor fascia lata, which you are seeing it coming from anteriorly, and this is the iliac crest you are seeing, and this is the attachment of the iliac crest to the tubercle and to the anterior 5 centimeters of the outer lip of iliac crest. And it also receives nearly 3/4 of the gluteus maximus, which gets inserted into the iliotibial tract. So it receives the insertions of two muscles, tensor fascia lata and the gluteus maximus muscle. And below, it receives expansion from the vastus lateralis in the lower part of the thigh. The functions of iliotibial tract. Along with associated muscles, that is tensor fascia lata and the gluteus maximus, it can extend, abduct and laterally rotate the hip. and it can contribute for the stabilization of the knee, and it stabilizes the pelvis and assists in knee extension. So it acts as a warm aponeurosis of muscles, the gluteus maximus and tensor fascia lata. Now you are seeing the muscle again. Focus on the iliotibial tract and the tensor fascia lata and the gluteus maximus muscles. So to review the functions of it. So contraction of gluteus maximus and tensor fascia lata results in contraction of the iliotibial tract and makes the iliotibial tract tense, with the result the condyles of femur are steadied on condyles of tibia. Condyles of femur are steadied on condyles of tibia, and that maintains the standing position with least muscle fatigue. Now you must have understood the function of the iliotibial tract. What is the clinical importance of iliotibial tract? Inflammation of iliotibial tract can result due to overuse, injury during running, cycling or any other activity that requires repeated flexion of knee and hip joints. So that is called iliotibial band syndrome due to inflammation of the iliotibial tract, and the pain and tenderness will be found above the knee. So the iliotibial tract is a thickening of deep fascia of thigh, that is fascia lata, along the lateral aspect of the thigh. It extends from ilium to the tibia and it gives insertion to the two muscles, the gluteus maximus and the tensor fascia lata, and it facilitates standing erect. Extended position of the hip and knee is facilitated by the iliotibial tract.